so we're doing a talk on heart disease today. So, the function of the heart is to pump oxygen, blood and nutrients through the body's blood vessels to the cells of the body. So the heart's divided into 4 chambers, 2 atria and 2 ventricles. The blood is carried to the heart in the veins via the atrium. So it passes into the ventricle and is pumped out via the arteries. So blood flows between all the 4 chambers, and the main blood vessels is controlled by valves that prevent the backflow of blood. So the heart wall is divided into 3 layers. So you've got your endocardium, your myocardium and your pericardium. So the valves between the atria and the ventricles are called the atrioventricular valves. So the mitral valve is the most common one that you'll see that is diseased. So how the heart works. So you've got your cardiac cycle, so the chambers of the heart contract in a coordinated manner. Atria together, then the ventricles together. So the atria is up the top of the heart and your ventricles are down the bottom there. So contraction of the heart occurs due to an electrical impulse stimulating the cardiac myocytes. This electrical impulse comes from the pacemaker, an area in the right atrium. So these electrical impulses may change in heart disease, and they can be recorded using an electrocardiogram, ECG. So when your heart contracts, do you know what that's called?
I just read it.
Same. The systole, and then the relaxation is your diastole. So you see that on your blood pressure monitor. So you've got your systolic.
As the heart's contracting, you get your systolic, and as the heart's decontracting, your diastolic.
Diastolic.
Yeah.
And then
you
one
get
in between.
That makes sense why they're called that.
Yeah. Yeah.
Oh my god, something makes sense.
For a change.
Alright, so then you've got your circulation of the heart. So your pulmonic circulation is your deoxygenated blood from the body is arriving back through the right side of your heart and is pumped to the lungs, where you get oxygen through the lungs into the blood, and then it goes back into your left side of the heart. Your systemic circulation is then your oxygenated blood, which has come back from the lungs, and then is pumped around the body where it deoxygenates and then goes back to the heart. Alright.
Oh, I get it.
Yeah?
So I was like, heart, A, body, A, heart. I'm like, what does that mean? And then like, oh, heart to the body, to the heart. Got you. I'm clicking.
Alright, so your blood flow. Does anyone know what the vessels are called that leave the heart?
Arteries.
And then...
Veins.
Yeah, vein.
Capillaries, yeah.
Close.
Close.
Anyone know what vasodilation is without reading that?
It's where,
Think of it as vessels.
yeah, the vessels open up wider.
Yep.
So more blood flow goes through, and then constriction,
Yep, vasoconstriction.
yeah, is where it closes down and less blood flow gets through.
Yep.
Nice. Nursing talks that come in hand.
Mm.
Do you think vasoconstriction puts an increased load on the heart or not? Do you think the heart has to work harder to pump blood?
Wouldn't it be the other way around? Because there's more blood flow going through on dilation, so more blood flow is getting through. So would that not mean increased blood pressure because it's more flow? So it's the other way around.
Mm.
Huh.
You think you got like your so your arteries and they're constricted, so you're trying to still pump the same amount of blood
Ah,
through
through a
that
small.
tiny space. So your heart's like
That
It's
makes
really
sense.
working harder to push it.
yeah,
Because whereas
To get it to move
your
faster.
vasodilation, it's a normal sized
yeah.
So the blood's
artery
going
or
through
vessel.
nicer,
Mm.
And it's
smoother.
flowing easy. Yes, it may work harder, but it's not working as hard as if it's
The other way
smaller.
around.
Yeah.
Makes sense.
Alright, so what is heart disease? So your heart disease involves a decrease in the effectiveness of the heart pumping blood around the body. As a result, this can build up fluid in the chest cavity and abdomen, causing breathing difficulties. There are two main heart conditions. One affects the heart valves and the other one affects the muscles of the heart. So the one affecting your heart valve is called chronic valvular disease. So it's a leaking heart valve which reduces the quantity of blood that can be pumped around the body. So when the heart pumps, your valve isn't going to close up properly afterwards, so it's some of the blood's going to backflow when it pumps again. So it's not pumping right through.
And is that where you get your murmurs?
Yeah, I think so.
The wishy-wash sound.
Yeah, the wishy
Yeah,
sound.
yeah.
Because
Because you're hearing
washing
the valve
machine
doing this
doing it,
and the
yeah.
blood's backflowing.
Yeah.
And the other one, which affects the heart muscles, called myocardial disease. So myo is your muscles. So in this condition, weakness or thickening of the heart muscle results in the heart pumping less effectively.
And is that when we have to take an X-ray and then we notice an enlarged heart? Because you can't
So
really
like
pick
you
up an
can-
enlarged heart by listening to us oscillating the
Yeah.
heart.
So like your cavities and that.
Yeah.
Would the valve problems be associated with fluid, like in the body?
Yeah.
Excess fluid build-up?
I think both of them would,
I think
to be
both.
honest. But yeah.
Because the leaking of the leaking of the heart valve would
Because
do
you'd
that
have
as
backflow
well.
into the lungs.
Yeah,
Mhm.
I believe you'd have that too. I think it would be both.
Yeah.
But to know the difference, who knows?
Yeah, because even though you've got the thickening of the heart muscles, it's not pumping
This is
as
where a vet
effectively.
should be sitting right now and like giving us answers.
Mm.
Alright, so does anyone know what common breeds of dogs are
Cabbies.
affected? There's quite a few.
Doberman?
Yes.
Was that a yes?
Yes. Just checking, yes.
Spaniels, just in general, spaniels.
Yeah, yep. German Shepherds?
Any large dog.
So like your Saint Bernards, Old English.
Or giant breeds.
Yeah, big
Your
Great
giant
Danes.
breeds.
Yeah. Even your boxers, Cocker Spaniels. your
Are there any other
Spaniels.
small breeds other than cavies?
Schnauzers.
Schnauzers.
They're kind of your small, medium.
Schnauzers, and what about not bulldogs because they're just their skin, ears, and everything else other than heart.
Maltese as well.
I've known a couple of
Yeah.
terriers.
A lot of crosses.
Mm.
Maltese Shih Tzus.
Yeah,
They seem to.
haven't got it down there, but yeah, I think
That's true.
we see a lot of those.
Yeah.
Alright, so most dogs are aged 2 to 5 years old when the onset of symptoms occur. So they're quite young.
That is young.
Now, does anybody know what signs and symptoms of heart disease?
Coughing.
Yep.
Sluggish. Like lethargy.
Yep.
High heart rate, tachycardia.
Murmur.
Signs of heart disease.
Breathing or collapsing.
Like weakness.
And you've got like your fluid build up in the abdomen and lungs. Sometimes they get weight loss, reduced appetite.
I think one we missed was difficulty breathing.
Mm.
It's quite obvious. Yep. And then reduced ability to exercise, which would be from your breathing
Do
difficulties.
you know what the proper term of collapsing fainting is? That's good. You can learn. How do you say it? Syncope. Syncope. Syncope.
Where's
A
it
word that
written?
we can't pronounce. A word that I cannot pronounce. I'll ask Lorado when she comes back. I'll be like, what is syncope?
We can always say it, syncope.
Syncope.
They're all really hard to say.
Yeah.
Dyspnea? Is that how you say it?
Yeah,
Yeah.
dips
Yeah.
down. That's
Yeah.
fine. It's like when you have to go like tachycardia, and then it's like, I don't know where I'm going from there.
That's it. Alright.
Tachycardia. There we go.
So there's a few diagnostic techniques that you can use to diagnose heart disease. Does anyone know what we use most commonly?
Radiology.
It's something we use every day.
What will that show up?
Or
The size of the heart.
Yep.
So we can measure it
ECG.
with the actress.
Mm-hmm.
What else do we use? Oh,
ECG.
the stethoscope.
Yep.
Yeah, stethoscope.
Mm-hmm.
What do we monitor when they are?
Respiratory rate.
Yeah. The vets tend to send them home, get the owner to record their resting respiratory rate and let us
Do
know.
you know what the range is for that? We don't want it higher than a certain
Certain
number.
breaths per
It depends on the size of the dog, though, doesn't it?
I don't think so in that case.
No.
Because most of them, even with all sizes, most of the vets have said the same. They don't
Yeah.
want it above a certain.
Is it over 20?
No.
30? I was like, I knew it was in the 10s, I just couldn't remember which one.
No one over 30, then that's sleeping. It's not awake, it's sleeping.
Alright, so the management of heart disease. Do you know what we can do to manage it?
Medication?
Fluzapex and Vetmedin.
And
What else do you guys use here? Vet Ace, is it?
that was the only other one I was looking for, really.
A few other things like exercise and weight management. If you've got a really large obese animal, it's going to put more
What's the
pressure on
cardiac
it.
diet? Is that the raw canon one? The hepatic one?
Yeah, you can get Royal Canin cardiac diet, but we don't.
There's a Hills one too.
Let's say, I'm curious, is it effective?
We never bothered using it.
That's what we've
I
done
think
with
that
raw
we've
canin.
only ever had one patient on it before.
Do we just think medication's the key? Which I think it is, to be honest with you.
I don't see how you can manage that with food.
No, it's different with like maybe your thyroid and things like that.
And liver, something like that. You
It
could,
works
like
on
where
lymph
it
nodes
works
and
with your
stuff.
food.
Yeah, interesting.
Alright, so there's certain types of drugs which Nicole has already gone through for you. You'll ruin the next slide. No.
Sorry.
Alright, so we've got Forticor and Vet Ace, which they have the same active ingredient in it. Vetmedin and furosemide. See, furosemide's a diuretic, which we explained that you can get the...
Drains the fluid.
They've got fluid on their lungs, so it's going to drain it.
Is Vet Ace and Forticor, they're blood pressure related though, aren't they?
Let me have a look. I can't remember. They're ACE inhibitors, so vasodilation, less retention of sodium and water, slows cardiac remodeling, prevents degenerative renal changes as well. Because sometimes you can get renal disease associated with them because of the medication.
Oh, they're on
That's what happens to kitties. I thought you were going to answer that then. I was like, what are you doing, buddy?
I reckon we do a talk on like once a month or something. on, like,
Medications?
medications.
It'd be really good.
Yeah.
Yeah.
Because then when you're
Or-
explaining it to people at the
Yeah,
reception desk
I know.
saying, here's your blah blah that you're going home
Yeah.
with, this
is
does.
what it does,
blah, blah.
especially with heart meds, because I find I can't even do it for you.
Yeah.
Mm.
There's a bit of an explanation on here about each of them, so you can read them in your own time. So, nursing a patient with heart disease is important because they're quite complex patients. So, does anyone know what we need to consider when nursing a heart patient? So what things would you check?
Change in the heart, like regulation of the heart. So whether we're seeing arrhythmia, murmurs, whether it's stopping,
Yeah.
all those kind of things.
Yep. So pretend you've got a patient in here at the moment and you're going up and checking on them.
Blood pressure as well.
What's your normal things that you would do for
Respiratory
anything?
rate,
Yeah.
temperature, all the standard TPRs and stuff.
TPR, yep. When you're checking their respiratory rate, do you know anything extra that you'd be looking for?
Whether they're panting, colour of gums,
Yep.
effort.
That's a big one.
Could be looking at whether they're abdominal breathing.
So obviously we don't want them to abdominal breathe. You want them to be breathing normally from their chest.
Yeah.
And if they're abdominal breathing,
Sometimes it's when they've got
What?
fluid on the lungs, it's harder to breathe, so then they use their abdomen.
I'd be placing an IV catheter so we can get frusemide if it's got fluid on the lungs.
Do you guys do drains here? Like abdominal drains?
Oh, the synthesis drains.
Yeah, the ones where you put like the big catheter in the abdomen.
Yeah.
And it
that
drains?
is,
I've done chest ones before.
yeah, we've done chest as well. Bloody hell. It's in my head.
I have no idea what the name of it is.
Oh, it's in my head. It's right there. Anyway, it's an abdominal centesis, or you can. That's when you're draining it from obviously the abdomen, and then you have your chest centesis that you do.
Because it's from the actual
You go from
thoracic
specific,
cavity
exactly,
or the
and
abdominal
you go
cavity.
To a specific part of the lung.
Yeah.
You don't just choose any part of the lung.
Mm.
So it's like I think like the intercostal spaces in the lungs where they put in a butterfly catheter,
Mhm.
and then we have a three-way stop, clock at the end, and then you drain as
Yeah.
well. Like it's a full procedure and stuff. Like,
It is.
It's quite
And
invasive.
some of it you can like
and you can
mount.
cause,
It's
you
unbelievable.
can cause cardiac arrest from that as well. If you're like draining just air, or if you're draining too much, or you know. I'm gonna have to go look that up.
Yeah.
It's gonna bug me.
Now, would your patient be on fluid therapy?
Dependent on the case. But
Most of the
putting
time
on
we
fluids,
avoid
you
it.
wouldn't. Yeah, you wouldn't because you'd be putting more fluid in the body when it's likely that they've already got too much.
So if they are on fluids, you would be monitoring their chest sounds.
Mm.
So
Listening for
you know,
any.
seeing if they're crackling or wheezing they might already have some crackling and wheezing from fluid buildup, but you want to see if
Would-
that's getting worse or their respiratory efforts getting worse.
Would you be checking it every hour if they're on fluid therapy, or shorter periods of time?
Depend on what the vet says, but I would probably say half an hour. And depending on the rate they're on,
Exactly.
like
Yeah,
whether they're on
depending
shock rates based on something that's happened,
Majority of the time,
or whether it's
wouldn't do that
yeah.
because that's making them work harder, and that's pushing them maybe further into cardiac arrest because their body has to work
Harder
harder
the
and harder.
lungs work, and the heart's got to work harder to pump the oxygen around the body too, through the blood.
It's literally a case by case thing.
That's what I mean.
Yeah,
I'm thinking
it
of
is.
trauma cases, like if a
Yeah.
trauma case
If we're
came in that
thinking
has
just
heart
general,
disease,
like heart
be
failure,
hard.
yet they're
but general heart failure you
General
wouldn't
heart
put on it
failure,
at all, I
and
would
they
say.
are severely dehydrated.
Yeah.
That's when
Would you not give it subcut then?
that's the thing. But then at the same time, you don't want to have all that fluid that's under the skin be going through the body.
Through the, rather than actually going to the veins.
Exactly.
Yeah, it's
Well,
hard.
it's a slower diffusion of it going in the body, but how much of that subgut fluids are you actually giving? Because all of that's going to go into the body at the one time. Like if you give 10 mils straight away is going to go into the body.
Yeah, that's true.
compared to IV, I'm going to give 10 mils over an hour.
That's true.
That was just a thought, just a thought theory.
So you'd also monitor the patient comfort as well, so make sure they haven't urinated in their bed, they've got a comfortable bed.
Oh, you'd have to walk them regularly too,
Yeah,
because
they
they will be
And
a
if
lot.
they've had diuretics, that increases their urine output.
Yeah, that's what I mean. Like if
Yeah.
they're on their meds, they
Yeah.
pee a lot.
Yeah.
And then just your normal with your medication, just ensuring that you've got the correct patient, correct time, correct date, drug and route.
What's that? The acronym for that?
I don't remember.
Do you remember what it is?
Sorry.
You know how they've got the acronym for nursing for the correct patient, correct date, correct time, correct drug, correct dose? Like route, sorry. Do you remember? There's an actual nursing acronym for it.
I have no idea. Sorry.
Anyway, sorry, continue Zoe.
I'm a little bit useless.
Um,
You can tell I didn't get taught the nurse acronym.
Alright, so yeah, just a few observations which we went through. Basically your heart rate, your murmurs, arrhythmias, respiratory rate, you check their temperature, mucous membrane, hydration. If they've got a catheter in, you check if it was patent before giving any drugs. So just flushing it to make sure it hasn't come out the vein or it's clotted with a blood clot or something like that.
Avoid pushing a blood clot
Yes,
through the system. Disease dog anyway.
definitely. With any animal,
Really? Really?
Um,
Especially one that already has a failed
yeah.
heart.
Most of the time they're going to feel like crap anyway, so they're probably not going to eat and drink a lot. So you need to monitor if they're eating and drinking. Try and encourage them to eat and drink. So I guess depends on what the vet wants to feed them, but if they're really inappetent, I guess it would be something like recovery. Yeah, just anything that'll entice them to eat. Try and warm it up. And you can syringe feed them or hand feed them if the vet decides to do that. And just their general demeanour, so if they're bright or depressed, quiet. Sometimes they might be vocal if they're in pain. You can assess their pain levels. And then if they're in here for a few days, you need to check their weight every day. Make sure they're not losing too much weight from not eating.
So how you would monitor fluid as well, as like, because you would see their weight increase
Yeah,
based on fluid.
Yep. And just also the positioning of the patient. So sometimes they're a bit lethargic, they won't move a lot. So if they're laying on their side, you're going to get, and they've got, fluid in the abdominal lungs, it's going to pool on that side. So you need to help them turn over. Just move their position if you notice they're in it for too long. Alright, so your ECG, just a quick bit about that. So it can be used to both monitor and diagnose heart disease patients. So it measures the electrical activity of the heart in waveforms. So this here is what a normal heart rhythm would look like. So to monitor a patient, you need the environment to be very quiet so that they're not stressed out, and just make sure that they're relaxed as possible so they're not moving around a lot. Positioning.
Did you discharge Hunter this morning?
Yeah,
Did they take gabapentin capsules?
yeah, for the other
Oh, they did.
patient.
Oh,
Yeah,
cool.
yep,
Did they pay as well?
yes.
Oh, cool.
So positioning in your dogs is more important than your cats. So you want to place them in right lateral recumbency. Cats, it's kind of just whatever's comfortable for them. And then, yeah, you've got certain wavelengths, so your P, Q, R, S and T. So that would be your ideal reading there. Without going into it too much. Otherwise, that's it. Got any questions or?
Have you guys had Richard Woolley come out and do the echocardiograms here?
Yeah, yeah.
Awesome.
Yeah, he comes every so often.
He's really cool.
Yeah,
And he really explains it to you as well. Like, he's really good like that.
yeah.
But no, that's all good.
It's all good.
Awesome, Zoe.
All sounds good.
I'm going to end that.